Hi everyone, my name's Taylor, and I am going to be looking at exercise with those that have cancer or have survived cancer. So we're going to get started. So, what exactly is cancer? So, cancer is a very broad disease and diagnosis. There's over 200 diseases that encompass cancer that can affect any area of the body. Okay, so it doesn't have to be, it can be anywhere. So that makes it very different when prescribing an exercise prescription for these people. Cancer is caused by continuous and uncontrolled growth of abnormal cells that form due to damage to one's DNA. So these are mutations. We have mutations every single day in our bodies with ourselves, but with those with cancer, our body doesn't find those mutations and break them down and get rid of them like they usually do. They instead keep building and growing, and that's what forms those tumors and cancers. So, the cause of cancer is carcinogens. These can be environmental, such as tobacco smoke, certain chemicals, things like that. And that's one of the main causes of cancer that we know of. It can also be genetic, so things that are internal that are already encompassed in our DNA. And that's why some cancers tend to run in families. And what's going to be important when it comes to exercise with these people is that most of those diagnosed with cancer are over the age of 55. And we'll kind of go into later why that's important to remember. But we also need to know that this can affect any age group. There's children that have cancer, but just most of the time it does occur in that older population. So further information about cancer here. Most cancers are classified according to where they originate. So, for example, blood cancer is termed leukemia because Luke means blood. Immune cancer of the immune system is called lymphoma because lymph is short for immune. So, just that can help you narrow down where exactly their cancer might be based on what we're able to see in the name itself. The lifetime prevalence of cancer is 1 in 2 of men and 1 in 3 in women. So it is very, very, very common, unfortunately. So if you're an exercise professional, you're more than likely going to see a lot of these cases. So that's why this is so important. About 78% of all cancers are diagnosed in those over 55. We talked about that in the previous slide, but that just kind of gives you a percentage just to kind of think about. Treatment of cancer may involve surgeries, radiation, chemotherapy, hormones, and immunotherapy. So there's a lot of different ways that they tend to treat cancer, and a lot of the times these treatments will damage healthy tissue as well. In their fight to kill the cancer, they also kill healthy tissue as well, which can sometimes cause other issues on their own. So we'll kind of go into that too. So special considerations when it comes to exercise testing. So cancer and cancer therapy have the potential to affect the health-related components of physical fitness. So those are your things such as cardiorespiratory fitness, muscular strength, muscular endurance, body composition, flexibility, all of that. So that's important to remember is that sometimes the cancer treatment itself can cause there to be limitations in those areas. As fitness professionals, we need to understand how patients have been affected by their cancer prior to any form of exercise testing or training. That's because most of these cases are going to be extremely unique to the individual, just because, again, cancer is such a broad diagnosis that you're usually not going to see the same case twice. Because of the diversity of cancer patient population, the safety guidance for pre-exercise evaluations for those with cancer focus on general as well as cancer site-specific recommendations. So there is a general fit recommendation. I'll be going over that in the coming slides, but there can be certain recommendations by the ACSM that are more specific if you have cancer in a certain area. An example of that would be breast cancer is you want to be able to assess their arm and shoulder mobility just because all the time with breast cancer, especially if they've had a mastectomy, that muscle has been cut through and that can affect their mobility, the range of motion, and then hinder strength training, that kind of thing. So there are special considerations that need to be focused on when working with cancer, and that's why you need to get a good health history from them in order to create a correct exercise prescription. A little bit more about special considerations for exercise testing is no assessment is required to start a light intensity walking, progressive strength training, or flexibility program. So as long as it is of light intensity, no assessment is needed there. It is perfectly okay for them to start that on their own. We need to be aware of all other conditions before exercise testing or training. So this is where we go back to most people with cancer being over the age of 55. A lot of people over the 55 also have other health conditions along with their cancer that we need to be aware of. High blood pressure, high cholesterol, obesity, things like that, that we also need to take into consideration prior to doing an exercise test or a training session. Health-related fitness assessments may be valuable to evaluate how cancer and treatment have affected the body. And the next few slides, I have an example of what that might look like. There's no evidence that there needs to be more medical supervision for submax or max exercise tests than the general population. So just because I have cancer doesn't mean that, okay, we need to have more doctors there just in case, or we need to have more nurses, you need to have an exercise physiologist, anything like that. It can just be the same as for the general population there. And then we also have to understand that the most common toxicities associated with cancer, so bone fractures, cardiovascular events, neuropathies, those kinds of things, those are going to be more common in this population just due to their treatments, and also it can be affected on where their cancer is as well. So I said I was going to give you an example of a physical activity assessment. So this is an assessment you would go over prior to an exercise test or training, and this will kind of help you put that all together. The first thing you want to look into is their focused clinical evaluation. So that's pretty simple. We usually do this for the general public. This isn't just something that we do for those with cancer. That's going to be something such as weight and BMI, blood pressure, history of anemia, because a lot of times that's something that people with cancer do have. So we need to be aware of that. Baseline activity level, so how much are they currently exercising, how many days a week, what intensity, all that stuff. Any barriers that they might have to physical activity. So these can be environmental, time, stress, financial, all of that. If we're able to pinpoint those areas that might cause some issues when it comes to sticking to a fitness program, we can help to keep those from popping up and help them stick with it. A review of symptoms, a lot of the times with cancer, is obviously going to be cancer symptoms or symptoms that are related to their treatment. And then also disease status. Are they recovered from cancer? Are they in remission? Are they currently undergoing treatment? Those are all important to know. Next thing you're going to look at is the assessment of treatable contributing factors. So these are things such as pain, fatigue, emotional distress, nutritional deficits or imbalances, and medications. This is going to be really important for those with cancer because, again, they're probably going to have pain based on where their cancer is, fatigue from their treatments, emotional distress because it's a very stressful time for them, nutritional deficits and imbalances because a lot of times when people go through these treatments, they do get sick and they don't feel like eating, and then medications. Usually they're on some sort of medications, especially if they have had an organ transplant or anything like that. They might be on immunosuppressants. So that's all important to know because that will affect the environment they are exercising in. And then finally, you're going to look at the assessment of comorbidities and treatment effects as appropriate. So we do some of these for the general population, but some of them are specific to cancer patients as well. So these include cardiovascular disease, pulmonary disease, arthritis, or musculoskeletal ailments, which we talked about are more common in those with cancer just because their bone density is usually diminished. Lymphedema, so swelling, that's really important to watch for as well. Peripheral neuropathy, are they have any numbness, tingling, especially in the feet, hands. Bone health and strength, which kind of goes back into those musculoskeletal ailments. Incontinence, do they have any issues going to the bathroom? That can all affect exercise as well. A presence of a stoma or ostomy, you're going to see this more often in people that have colon cancer. And then need for assistive devices. So do they need a cane? Do they need a walker? Are they in a wheelchair? And then steroid myopathy. So these are the things we want to look for and be aware of before beginning exercise testing or training. So special considerations for exercise training. Going into the training aspect of this assessment, we want to avoid inactivity during and after treatment. A lot of times when people are going through cancer treatment or they've been diagnosed with cancer, they don't want to be active. So we want to try to help get those individuals motivated and make sure that they are not inactive. A single precise recommendation regarding the FIT principle is not possible to the large diversity. So again, we talked about this. I will give you a general FIT principle for those with cancer, but again, you're going to need to narrow down where that cancer is in order to create a more specific exercise training program for them, just based on what their condition currently is. The same goes for the general population for those with cancer, so 30 to 60 minutes of moderate to vigorous intensity physical activity at least 5 days a week. So that's the same as the general population. That is the same thing we want to have for them as well. Exercise professionals need to use good judgment on the progression of the program. These people are going to need slower progressions, so we need to progress effectively and make sure that we're not wearing these people out, that we're not overtraining them. And then no location was found to be more beneficial in terms of survivorship. So they are able to exercise wherever they want, home, in a more clinical facility, or in just a normal gym. There was no difference between any of them. So all three would be beneficial. So like I was saying, this is going to be a general outline for what a fitness program will look like for someone with cancer. I'm probably cutting a little bit off at the top for my picture, but I'll do my best to kind of show you what you might not see. So pretty general. We'll go over aerobic training first. So 3 to 5 days a week of moderate to vigorous intensity. I like to use RPE just because it's a lot easier to measure. And it's something that you can show them a chart and they can see and they can point to what it is, instead of you having to measure something, especially if they're on medications. Heart rate might be a little funky, all of that. So an RPE of 12 to 13 or an RPE of 14 to 17, just depending if they're doing moderate to vigorous activity there. They want to do about 75 minutes a week of vigorous intensity or 150 minutes a week of moderate intensity, or you can combine both. So if you want to do moderate and vigorous together, find the happy medium. A type of aerobic activities that would be beneficial would be prolonged rhythmic activities using large muscle groups. So things such as walking, cycling, bicycling. Those are all going to be beneficial. Also swimming, especially if they have joint or bone issues. Swimming will give them a low impact option there. Moving on into resistance training, 2 to 3 days a week. Start with low resistance. You want to do less than a 30% 1 rep max, so really low. And progress with the smallest increments possible. Again, slow progression is very needed here. And time, you want to do at least one set of 8 to 12 repetitions to start. Again, slow progressions afterward if that becomes too easy. You can use free weights, resistance machines, or weight-bearing functional tasks. Weight-bearing functional tasks might be something you use a little bit more, just because you don't want them to lose their day-to-day movements that they will need for daily living. And then what I might be cutting off is flexibility. So frequency is going to be at least 2 to 3 days a week, with daily being the most effective. You want them to be able to move through the range of motion as tolerated and then hold that stretch for 10 to 30 seconds. And that's for static stretching. You want to try to get all the major muscle groups. But then again, this is something that's going to be a little bit different for those with cancer, is you want to be able to address any areas of joint or muscle restriction. So a lot of times if they've undergone surgery or just have cancer in general, they might have areas that might be restricted, be really tight. They're not able to move the right way. So we want to focus on those areas when it comes to flexibility, and hopefully we can loosen them up. Again, you don't want to cause them pain. It says as tolerated range of motion. So you don't want to cause anything super uncomfortable, but you do want to target those areas in the hope that they will get normal mobility back. And then finally, we have some unique special considerations just for those with cancer, just to kind of finish off. Symptoms and exercise can be highly variable. So they might feel really good one day, you work with them the next day, and it's a completely different scenario. They might not just be feeling too well, those kinds of things. So because of their treatments and because of the disease in itself, all that can be very variable. Slow progressions are needed. We talked about that. Those with lymphedema should wear compressive sleeves during resistance training. Increases in physical activity can be done with those currently undergoing treatment. So just because they're going through treatment doesn't mean that they can't exercise. Then several short bouts per day rather than single bouts if they have less energy. Break up that time period. Up to 90% of all cancer survivors will experience some sort of fatigue related to their cancer. So again, fatigue is going to be very common here. And bone is a common site of metastasis, so special considerations there, especially watching for fractures and musculoskeletal injury. Muscle wasting is prevalent just because a lot of times their nutritional demands aren't met. And then immunosuppressed states need to be known and documented, because then you'll have to take certain precautions that are similar to COVID precautions. So again, this is your exercise prescription and considerations for those with cancer. Thanks.